Today I'm going to be talking about vitamin D and exercise performance. Some background: vitamin D is a fat-soluble vitamin. It's naturally present in only a few foods, added to some, and available as a dietary supplement. Flesh of fatty fish and fish liver oils are the best sources. Some orange juice, milk, yogurt, and margarine are fortified. It's also produced endogenously when ultraviolet rays from sunlight hit the skin and trigger vitamin D synthesis within the body. Here are the RDA values for male and female. 0 to 12 months is 10 micrograms. 1 to 70 years is 15 micrograms, whether you're pregnant or lactating. Greater than 70 years, the RDA is 20 micrograms. Functions of vitamin D. It promotes calcium absorption in the gut and maintains adequate serum calcium and phosphate. This enables normalization of bone and prevents hypocalcemic tetany. It's also needed for bone growth and bone remodeling by osteoblasts and osteoclasts, and without sufficient vitamin D, bones can become thin, brittle, or mishappen. Vitamin D deficiency can occur when usual intake is lower than recommended levels over time. Exposure to sunlight is limited. Absorption of vitamin D from the digestive tract is inadequate. This is often associated with milk allergy, lactose intolerance, ovo-vegetarianism, and veganism. Vitamin D deficiency diseases most commonly are rickets in children, which is the failure of bone to properly mineralize, resulting in soft bone and skeletal deformities. Also, osteomalacia, which often occurs in older women, results in weak bones. Toxicity. Nonspecific symptoms include anorexia and weight loss, pylorrhea, or heart arrhythmias. More seriously, it can raise blood levels of calcium, which leads to vascular and tissue calcification with subsequent damage to the heart, blood vessels, and kidneys. Excessive sun exposure cannot result in vitamin D toxicity. The study I did was vitamin D and exercise performance in professional soccer players. This took place at the University of Crete, located in Greece. 67 Caucasian professional male soccer players that did not meet any of the final criteria were allowed to participate. They cannot have any medical disorder that would affect vitamin D levels. Their contract could not end before the conclusion of the study, and they could not consume supplements containing vitamin D. The first aim was to examine the relationship between serum vitamin D levels and the ergometric evaluation of muscle strength, aerobic capacity, and speed in pro soccer players. The second aim was to evaluate the effects of the soccer off-season period on serum vitamin D levels. Methods. There was no exercise permitted for the first 2 weeks of off-season. Next 4 weeks, low-intensity aerobic running of 20 to 30-minute total duration 3 times per week divided by 1 day of rest. Each experimental testing consisted of 2 days of consecutive measurements. Each experimental period testing consisted of anthropometrics, blood testing for the assessment of vitamin D levels, and ergometry tests for the measurement of the squat jump, counter movement jump, VO2 max, 10 meters, and 20 meters sprint performance. First experimental testing took place immediately after the end of the competition period in May, the preseason, and the second experimental testing was performed at the beginning of July, just prior to the beginning of the preparation period for the forthcoming season. Subjects were instructed to abstain from any exercise training 2 days prior to testing. Vitamin D measurement was taken using venous blood samples that were obtained following a 10-minute period of rest in a lying position after an overnight fast. Ergometry. This assessed with a jumping mat and infrared photoelectric cells. VO2 max was performed on a motorized treadmill using an automated gas analysis system. The results. There was a significant positive correlation between vitamin D levels, squat jump, and counter movement jump, and VO2 max values at the beginning and at the end of experimental period. There was a significant negative correlation that was observed between vitamin D levels and 10-meter and 20-meter sprint times at the beginning and at the end of the study. Vitamin D levels increased significantly during the off-season period compared to the baseline. In contrast, the analysis of the data revealed significant reductions in squat jump, counter movement jump, VO2 max, 10 and 20-meter values at the end of the study compared to baseline. This was evident of a significant increase in body weight and body fat at the end of the study compared to baseline. More results. It provides evidence of a linear relationship between vitamin C serum levels with jumping performance and with VO2 max and speed. It also concluded that even The short off-season period of reduced training stress had a boosting effect of vitamin D levels. An increase in vitamin D levels was evident in parallel to a reduction in aerobic and neuromuscular performance parameters. Reductions in exercise training stress may also have beneficial effects of vitamin D levels, suggesting a possible association of its levels and the training-induced stress.